So I'm going to talk about now psycho-emotional factors as a root cause of illness. So we already know from research that having adverse events in childhood, trauma, abuse, etc. significantly increases your risk of disease by the middle of your life. So we already know that association is there. Now, like I said in an earlier video, I do consider it a really core issue, a real root cause issue. Psycho-emotional factors is not all just nutrition and detox and functional medicine. In my experience, the psycho-emotional factors play a huge role, and I always explain it to people that it's almost like, see it as a fire burning, and it's burning and it's driving the disease process. And even though by having good nutrition, good lifestyle, detoxing, taking the right supplements, etc., even though this really helps with symptoms, so anyone that comes to my clinic and they have symptoms, we do all of this work on the physical level, and it really helps their symptoms most of the time. But if there is a psycho-emotional root driving it, you're going to need to stay on that strict regime long term, strict diet, strict supplements, etc., because this is still driving it. So we need to work on this at the same time. So how do we do this? Talking therapy. So most people get referred for counselling, talking therapy. I find this very helpful if someone has no one to talk to. If someone just needs a soundboard, somebody to just offload to and to share everything with, express everything out of them, then counselling can be helpful. But that's really as far as I find it goes for most people. So it's limited. So good for those that need someone to talk to, but otherwise it can be really limited. The other most commonly recommended therapy is CBT. Can be really helpful, but again, it's actually about coping strategies. So it's better than counselling in that sense, because it's actually giving you techniques, it's giving you strategies and mechanisms to help you manage your situation, manage your condition, and which can be really helpful, but it's not really getting to the root issue. Now, you can have psychotherapies that delve far more deeply than counselling, and will take you right back to childhood and talk everything through, and you can get a lot of insights and really understand where everything went wrong. You can really start to have perspective and understand, and you will be coached through that whole process. You'll be held through that whole process. So this can be extremely helpful for a lot of people, but you can end up staying in that sort of therapy for years. And the progress can be limited because it keeps you stuck up here in the head, and it puts you into this over-analytical state as well. So we need to be a bit careful, a bit mindful of that. So what I prefer that my patients do, maybe they've done those things to begin with, or maybe they need a bit of that stuff to begin with, that kind of therapy to begin with, but actually more of a body psychotherapy, so a somatic therapy, because actually trauma, emotions, they stay stuck in the body, and that's what drives the disease process for many people. So we call emotion, energy in motion. You can break the word down to emotion, energy in motion, and we can see it as trapped energy. So this kind of fits with a lot of traditional medicine principles, like traditional Chinese medicine and other similar sorts of ancient medicine therapies and techniques and philosophies. But we also have it's come much more into Western philosophies within the integrative medicine and therapeutics fields. So I work a lot with practitioners in German New Medicine. This is an increasingly popular approach, which really targets specific conditions and organ dysfunction, and can relate it to very distinct emotional conflicts. So if you tell a German New Medicine practitioner, I've got this kind of condition, I've got this diagnosis, this part of my body's gone wrong, I've got these symptoms, the German New Medicine practitioner will actually be able to say, that is often directly related to this type of unresolved emotional conflict. Let's go back and see if we can find it. And I always say to people, if you hit the nail on the head with German New Medicine, it can work like magic. That's my experience. And it's a far more targeted approach than compared to normal mind-body therapy, which will be dealing with what's there, but maybe not really homing in on the actual disease state and where that's come from. So that's a really interesting approach. We also use EFT quite a lot in our practice. So emotional freedom technique, basically using the body's meridians like acupuncture does. So traditional Chinese medicine, they talk about meridians, which are energy channels within the body. And through acupuncture, you'll put needles to help release the energy at those points. Because in traditional Chinese medicine and in other forms of traditional medicine, they recognize that energy blockage is a problem and causes disease. So acupuncture helps to relieve that by basically interrupting the energy flow in that place. But an emotional freedom technique works on the same principles, but instead you're using tapping. So you're using actual tapping on these key acupuncture points. And when you combine that with a good therapist, a good practitioner who's experienced, insightful, intuitive, they'll actually be working with whatever emotional issues are going on for you at the time, and which will actually link you back to past insults, past issues, past traumas, where those emotions initially really originated. So it's a very interesting process, but it really helps to release that emotion from the body. So anyone knows when we're highly stressed, or we're deeply sad or hurt or really angry, you feel it, or really anxious, you feel it in the body. Yeah, it feels like all this stuff stuck in the body, and through somatic therapy you're actually releasing that from the body. So it gets really good results. We also have something called the felt sense polyvagal method. We have a therapist in the felt sense polyvagal approach, and this helps people to learn the language of the nervous system, which we don't currently have words for, but through this process you actually learn to work with your nervous system. So a lot of people will say to me, I just feel my nervous system is out of balance, I feel overly wired, and I feel out of control and out of balance, and I really feel it in my body. So they will actually tell me they can feel a problem with their nervous system. So through this process you actually get in touch with the different feelings within the body, and you actually become aware of things you hadn't become aware of in the past, and you will actually during the process see that change happening inside of you. So it's particularly good for trauma and addictions, but a very good deeper therapy, somatic therapy as well. So for me it's absolutely crucial to work with that mind-body connection if I'm delving deeply into someone's health problem, anyone's health problem, if they're ready to go there. If they're not ready to go there, we focus on the diet, the supplements, the detox, and we start to introduce the concept of this mind-body connection as well. But for me it's a really, really important part of recovery from any sort of illness. We also have specialists in acceptance and commitment therapy, which is a really nice approach to, it is a talking therapy, but it's a really nice approach to help ground someone, calm someone, very good for anxiety, depression. It's helpful with psychosomatic disorders as well. So that's something we use a lot of in the clinic too.